Washington Journal continues.
Jim Martin is the president of 60 Plus Association, and he's here to talk to us about older Americans and health care. He's going to be talking about the future of health care for older Americans, especially the elements of the Affordable Care Act that are being put into place. Welcome to the program, sir.
Thank you. Glad to be with you, Rob.
First, tell us, now that the election is over, what does it mean in general for older Americans?
Well, I think things like Obamacare, the Patient Protection and Affordable Care Act, the Affordable Care Act, the shorthand way to put it, quite frankly, seniors were opposed to it before it passed. They are still adamantly opposed to it. It has some good elements in it. It has some awfully bad things in it, we think, also.
Give us 2 or 3 of the things that you claim are awfully bad for seniors.
Well, first of all, the $716 billion worth of cuts from Medicare. Huge cuts. Senior citizens, you know, they like to say that they've paid into the system all their adult life, still paying in, seniors such as myself. But the fact is, you cut $716 billion out of Medicare. You add 30 million new customers. You've got 10,000 baby boomers retiring into the system daily. The numbers just don't add up. So I think seniors, apparently back in 2009, before passage in 2010, senior citizens were vociferously opposed to the bill back then. And back then, you know, people were talking about who read it, who hadn't read it. And the Speaker of the House at the time, Nancy Pelosi, said, well, we've got to pass it to see what's in it. I think seniors were the only ones who'd read it. They didn't like it then. They still don't. They saw these cuts on the horizon. And the fact is, I think we're going to start seeing rationing if we aren't already.
In a news release that was put out by the 60 Plus Association after the election, you're quoted as saying, Tuesday's results gave us a few more gray hairs, but seniors will remain a vocal force in politics and will continue to sacrifice to make our nation better for future generations. That despite Tuesday's election results, seniors will remain just as engaged in the political process and continue fighting for such things as opposing President Obama's deep cuts to Medicare, replacing Obamacare, and will remain committed as ever to balancing the budget, fixing the economy, and energy independence. Talk to me about the plans. What is it that you all want to do in the days during the lame duck part of Congress? Is there anything that you can do? Are you going to be lobbying members of Congress, some of whom may not be back in January, about your positions on health care and the like?
Well, quite frankly, besides health care, obviously you touched on a couple of things. Energy independence. The fact is, high energy costs impact seniors more than any other segment in our society, the high cost of energy. We say we need to develop our own domestic energy sources. I read recently, Rob, where the United States will surpass Saudi Arabia in oil production in just a few more years. We have so many energy resources at our disposal. Shale energy. This is hydraulic fracturing, called fracking, up in the Marcellus Shale in Pennsylvania, up in New York, out in North Dakota. You know, hydraulic fracturing, and fracking as it's now called, has been around for 55 or 60 years, but it's been too expensive. But with new technologies on the horizon, it can and does produce oil and natural gas. We have a 100-year supply now of natural gas. Huge input. And, you know, our overdependence on oil resources from unfriendly nations, we call that a clear and present danger, if you will, to our national security. In fact, it's a clear and present danger to our economic security. We've got to bring down the cost of energy, impacts seniors more than any other segment of our society. On top of that, the taxes during this fiscal cliff. Taxes impact seniors, again, more than any other segment. There's a tax called the estate tax. We call it the death tax. A lot of high-income seniors are impacted by that, but of course a lot of low-income seniors are impacted by the high cost of energy and taxes overall. So we're keeping an eye on that. We'll be watching closely as they, in this lame duck section. There are many, many things impacting seniors, but clearly high cost of energy, high taxes, Medicare, as we know it, needs to be fixed.
We're talking about the economy and older Americans, particularly health care and how it affects older Americans. with Jim Martin. He's the president of 60 Plus Association. If you'd like to get involved in the conversation, by all means, give us a call. The number is 202-585-3880 for Democrats, 202-585-3881 for Republicans, and Independents, 202-585-3882. That is for Democrats, Republicans, and Independents of all ages. If you also want to get in touch with us via social media, the address is Twitter at CSpanWJ, Facebook.com/CSpan, and journal at c-span.org if you want to send us an email. Before we get to our first call, Jim Martin, tell us what exactly is the 60 Plus Association?
Well, thank you for asking that. I started this organization almost 20 years ago as a counter to the AARP, the American Association of Retired Persons. Quite frankly, I've been in this town almost 50 years, having come here as a newspaper reporter when John F. Kennedy was in the White House. And I covered that tragic moment in our nation's history as a reporter. But little did I know that most seniors out in the 50 states, the older we get, a little bit more moderate to conservative in our viewpoint. But I found out, much to my surprise, that the AARP comes from a fairly liberal viewpoint. And so I started 60 Plus as a counter. We're now in our 20th year. We have about 7 million senior citizen activists. They have 40 million. We're not trying to catch up with them. We're just trying to offer seniors another viewpoint, a less taxes, less government, adherence to the Constitution. We make it very clear we come from a conservative viewpoint as opposed to their liberal viewpoint. One of the major differences between us and the AARP, they're selling a lot of products through the mail. We're selling a philosophy, limited government, less taxes, which impacts seniors.
Our first call for Jim Martin of 60 Plus Association comes from Paul. Paul's calling us from International Falls, Minnesota this morning on our line for Democrats. Go ahead, Paul.
Yes, sir. I would like to ask this gentleman, I'm sure without asking that he is a Republican and he's talking the Republican line. And doing so, he's saying that the $760 billion taken out of Medicare was taken away from the seniors, even though he knows it was used to strengthen Medicare and make it longer and give you a little bit more benefit. And it was taken away from the insurance companies because it was extra profit they was getting through Medicare. And I'd appreciate his answer on that. Thank you.
Well, yes, I am a Republican. I make no bones about that, but it sounds like Paul was talking the Democratic line. On the other hand,
right.
It's a matter of opinion, obviously. We like, quite frankly, when I started talking about cuts to Medicare, some people said there's savings. Yes, it's a lower rate of return, but that's the semantic cesspool, if you will, that we deal with here in Washington, D.C. When I started talking about cuts, people said, no, they're not cuts, or as the caller said, savings. But the fact is, even Speaker Nancy Pelosi started referring to it, says, yes, we cut over $500 million out of Medicare. So these were cuts, clearly and simply. And if you take money away from those health care providers, or the hospitals and others, that means there's going to be less care for seniors, less care. And quite frankly, there's even surveys showing that if you turn more and more to nurse practitioners as the doctor shortage becomes much more acute, then the fact is that you're going to have less care. And heart attack patients, for example, do not survive as well when they're handled by nurse practitioners instead of doctors.
We want to let our viewers know that we do have a special line for folks 55 and older. That line is 202-585-3883. Again, 585-3883, area code 202 here in Washington, D.C. for callers and viewers over the age of 55. Our next call comes from Albert, calling from DeSoto, Missouri. He is on our line for Democrats. Go ahead, Albert.
Okay. Let me first point out that I am a Democrat. I'm way over 65, and I would be interested in, well, it's almost evident now, how much the pharmaceutical and the medical industry donate to your finances compared to these 7 million people you're talking about. And also, it seems to me that people don't realize that doctors around the world have no place to escape to except the United States. So if we lose some of our local doctors, we're going to have Englishmen, Koreans, Frenchmen, German. Isn't that not true? In other words, they get a fixed, they have national health over there, and they get fixed incomes of a sort, at least limited incomes, and we get the ones that have not dropped out, as you're talking about, seem to be millionaires around here where I live. Almost none of them, are millionaires in the other countries. How does that work out in your philosophy?
Well, first of all, let me answer the question about the pharmaceutical industry and the insurance industry and the money that they give us. Fact of the matter is they don't give us a nickel. I'd like to give them my address, so if they want to send me money, I'd be glad to take it. The fact is that years ago, some 10 or 12 years ago, because we agreed with the pharmaceutical industry on a couple of issues, they donated some money to us. When you agree with someone, you try to help them out financially when you're working an issue on Capitol Hill. The fact is, I think the caller from Missouri, we ought to point out that the pharmaceutical industry and the insurance lobby was working hand in glove with the White House on Obamacare. Everything from importation of less expensive drugs from other countries. The Obama administration agreed with the pharmaceutical industry to stop those. We think that was not a good thing for senior citizens.
We're talking with James Martin. He goes by Jim in conversation. And he is the president of 60 Plus Association. We're talking about older Americans and the economy, particularly the healthcare situation. If you want to find out more about their organization, their website is 60, that's 60plus.org. While we look at the website, we'll take another call. This one is from Bill. Bill is calling from Little Rock, Arkansas, and Bill is 65 years old. Go ahead, Bill.
Yeah, I hit it this year, and I fortunately are, pretty good health, but I go to a few doctors, a lot of specialists for checkup. I'm still working, but I did get Medicare Part A. And when you go to these doctors now, there's two points I have, would like your comments. When you go to doctors now, everyone that I go to or that I take my mother to just is worried sick about this Obamacare thing. They are really worried that they're not going to have time for us, that they're going to, and they've all hired these AP and these advanced practical nurses, and who are good people and are very educated, but they're not MDs. I'm worried about that. The second thing I am worried about and have been is that any money that I've saved over my life, it is getting no interest under this president. He was supposed to have fixed the economy, and it's in the tank. I'm not getting anything. And those two things bother me as somebody who's 65. I can't live on my interest from anything that I've made, so I'm going to keep working. Thank God I've got a good job, and I love it. But I quite frankly am worried sick, and I appreciate your comments. Thank
Bill,
you.
will you hold on for a
Yes,
second?
sir.
I want to get Mr. Martin's response to your questions, and then I want to ask you a question about something that we saw in the news this morning.
Yes, sir.
Go ahead, Mr. Martin.
Well, first of all, I couldn't agree more with the caller from Arkansas than what he had to say. And I, too, am past retirement age. I'm 76. I'm still working, still paying taxes, obviously. But clearly, the doc fix, that's the thing that impacts doctors. That's the sustainable growth rate started in 1997, I believe, to try to hold down the cost of Medicare. The fact is, every year, the Congress has to address that particular problem. There are so many things that the Congress has to adjust, whether it's the caller talks, he's now eligible, of course, for Social Security and Medicare. The Social Security tax holiday is going to end now on January 1st of 2013, unless they do something about it. We call it a Social Security tax holiday. They took 2% away from the taxes being paid into the Social Security Trust Fund. Hey, that was a nice way to reward a lot of taxpayers around the. It's buying votes, if you will, in my estimation. They should not have been taking money out of that Social Security Trust Fund. It is going. In fact, in 2010 was the first time that not enough money came into that was needed to pay out. There's always been a surplus since LBJ days when President Johnson was in office. They started putting it into the unified budget to help mask the overall deficit. The trust fund is going to run out of money. And when I saw that 2 years ago, they took 2% away to provide a tax break for a lot of it. Sure, it was a nice tax break, especially for low-income seniors. But still, that was stealing from that trust fund. We don't call it a trust fund anymore. We just call it the Social Security Fund. There is no trust there, in my estimation.
We picked this up, our producers picked this up from the Huffington Post business section earlier this week as part of the research. With the headline, Medicare eligibility age in fiscal cliffs negotiation puts older Americans in the crosshairs. And they write, when Congress returns for a lame duck session, talks will heat up to prevent the budget cuts and tax increases known as the fiscal cliff. Next year could bring reinvigorated discussions on a grand bargain to address the budget deficit. The last time that happened, President Obama reportedly considered a proposal favored by Republicans to extend the eligibility for Medicare by 2 years to 67. So my question to you, Bill, as a guy who just turned 65, your thoughts about extending the eligibility age on Medicare to 67?
You know, I think if you're younger and you're not expecting it, you're not thinking about it, I think that it would be probably very prudent to do that for the health of the country and the future of the people. Now, I don't think. Obviously, if you are at or near 65, you can't do it. The thing I wonder, sir, is as part of this whole situation, why is there no effort to really cut federal government spending? I don't understand why that's not on the table. Sure, I think you have to put the age on the table. Thank God for the doctors and the medical care. We are living longer, and a lot of people are working longer. And I think that the retirement age for people who are younger can be extended gradually, just like it did. It was 66. It's 66 for me as far as getting Social Security. But I don't understand why there isn't more. I'll tell you something. I work for the federal government. At the end of every fiscal year, we have money left over, and all of a sudden, everybody gets a new desk. They get a new chair. We don't need a new desk.
We'll leave it there, Bill, in Little Rock, Arkansas. Go ahead, Mr. Martin.
Well, I agree there. You know, the Social Security age is now at 66, and now we're talking about Medicare raising it to 67. That's the Huffington Post article pointed out. But I would point out one other thing here. Yes, those that can afford it. I saw an interesting article by Ezra Klein in the Washington Post a day or two ago, and he was quoting a multimillionaire, the head of Goldman Sachs or one of these large corporations, who's making $15 or $20 million a year, and he said, yes, I can forego. We can push the getting Medicare benefits to 67, even 70. However, he's well paid. He doesn't need Medicare benefits. It's those low-income seniors, and not only low-income, other seniors who perhaps they aren't satisfied in the job they're in. They're getting close to 65, and they're saying, I'm tired of working. I've been paying into Medicare and Social Security all my life. I'm looking forward to those Medicare benefits. They don't have the financial wherewithal to withstand that, to raising that age. So I do not favor raising the age on Medicare recipients.
We're talking about health care and other economic issues for older Americans, folks over the age of 60. With Jim Martin. He is the president of 60 Plus Association. And we want to remind our viewers and listeners that we have a special line for those over the age of 55. That number is 202-585-3883. Again, 202-585-3883. Our next call comes from Charlie in Pittsburgh on our line for Republicans. Charlie, you're on the Washington Journal.
Good morning. Thank you for C-SPAN, and thank you, Mr. Martin, for getting an organization for Republican voters over the age of 60. My question is about tax reform. I find myself in the same position as many older Americans, where we get a pension, but it's not quite enough to where your life is more comfortable, and you go out and find a part-time job, and that's what I did. And unfortunately, my problem is that they take your earnings that you make at your part-time job and add that on top of your retirement income. So what I would like to see is somewhere in tax reform where your earned income is taxed at a different rate than your retirement income. In other words, they add my income onto my retirement, and I paid a marginal rate, a higher marginal rate on my earned income. I think your earned income should begin as if you were just filing on earned income. Thank you for taking my call.
Yeah, absolutely. And again, you know, something we've done at 60 Plus, by the way, Rob, and to the caller from Pittsburgh, there was a there was an earnings limit imposed years ago, and we at 60 Plus worked with members of Congress to get that earnings limit raised. There's no limit now on what seniors can earn. I think it was we called it a 33% tax. You lost $1 of every 3 of your Social Security benefits if you earned over a certain amount. The jobs were going begging. A lot of young kids didn't want to go flip hamburgers at McDonald's for $7.50, $8 an hour. A lot of seniors did. But the fact is they were being penalized. And I'll never forget, from Fort Lauderdale, Florida, where I grew up, Congressman Clay Shaw, who was then chairman of the Social Security Subcommittee, Republican when they controlled the House back in the mid-1990s, and we were able to show him that jobs were going begging, if you will. And I'll never forget, he went home, he'd been in Congress for 20-some years, he'd been a county commissioner before, and he came back and he said, that's the best thing I've ever done, because a barber, where he was getting his hair cut, told him, says, Congressman Shaw, I've voted for you in the past. I've never donated to you, but I may donate now. And the congressman almost turned around and got his ears clipped. He said, well, why? And he said, well, I've been closing my barber shop. He said, I'm 69 years old. He says, every October 15th, I've figured out if I work past October 15th, I go over that earnings limit, so I'm losing 33%, $1 of every 3. So from October 15th forward, I may as well go fishing because I'm working for the government. So a lot of his friends thought he was making an awful lot of money. That's why he was had all this leisure time. He wasn't. He said, now I can work year-round without that earnings limit. I can make more money. I can buy more gifts for my grandchildren. He said, I'm 69. I'm so pleased. So that was something we did years ago, working with members of Congress on behalf of senior citizens.
And we have another senior citizen. This is Arlene calling from Tampa, Florida. She's 73 years old. Go ahead, Arlene.
Yes. Good morning. Anyway, I want to know why we're giving $450 million to Egypt and all these other millions of dollars to countries, and they're messing around with our Social Security. We worked for that Social Security. We put our money away, and they took the interest. They need to stop giving to other countries and give to Americans first. They should not be messing around with our Social Security. I worked till I was 68, and then I got spinal stenosis where I couldn't work anymore. And I can barely walk, and I just live on my Social Security. And I have only Medicare. I can't even afford a supplement, and yet people in America are starving. But we're giving millions of dollars to other countries.
James Martin, 60 Plus. Go ahead.
Well, thank you, Arlene, for that call. Yes, my favorite senior citizen, my mom, my sainted mom, if you will, would have been 96 years old this week had she lived. She worked into her 80s. And she depended largely on her Social Security check. And Arlene, I couldn't agree more with you. The fact is they've stolen from that trust fund for years and years. And I like to quote 2 former senators, the late John Heinz, a Republican from Pennsylvania, and Fritz Hollings, a Democratic senator from South Carolina. They held a news conference about 15 years ago, and they said, if we did in private business what we do here in the Congress, stealing from the trust fund for other purposes, that's called embezzlement, and you get locked up in private industry. But the Congress has been doing that for years, and seniors have paid into that fund. There's nothing but a bunch of IOUs there now. It should be stopped.
We've got a tweet here. This comes from Max 843, and Max wants to know, does Mr. Martin not understand the cuts to Medicare are not, all in capital letters, not to the basic program, but to the Medicare Advantage and to providers, not us? Sir?
Absolutely. As to providers like hospitals and others, and those providers are already faced with huge cuts. They're turning away patients, if you will. Doctors are leaving in droves. Doctors are refusing to take Medicare patients because of the lower reimbursement costs that the caller is talking about. The fact is, whether you want to call them cuts or lower rates of payments, they clearly have an impact. And I don't care how you semantically want to put it, these are cuts. These are cuts, pure and simple. And you know, when I was an old newspaperman, Rob, you could quote somebody long before video, and the next day in the paper, someone could deny that they had been quoted accurately. Well, nowadays, with video, here's former Speaker Nancy Pelosi, who said, yes, we have cut over $500 billion out of Medicare. And yes, Medicare Advantage, a program that's worked so well in the past, it still does. Those cuts are going to affect Medicare Advantage, but Medicare Advantage is one of those programs that has come in at a lower cost than traditional Medicare.
James Martin is our guest. He's the president of the 60 Plus Association. Previously, he covered Congress and the White House for 2 years during the Kennedy and Johnson administrations as a newspaper reporter and a radio and television broadcaster for 36 media outlets in the South. He was the chief of staff to Congressman and then Senator, the late Edward J. Gurney, a Republican of Florida from 1964 to 1969. And Mr. Martin helped to organize and direct several advocacy groups, including the National Conservative Political Action Committee and the Public Service Research Council, also the Americans Against Union Control of Government. He has a BS from the University of Florida. Back to the phones. Arnold is calling us from East Meadow, New Jersey, on our line for Independence. Arnold, you're on the Washington Journal. Thanks for waiting.
Good morning.
Good morning.
Very impressed with the fellow from Arkansas who is ready to raise the age of eligibility for Medicare, and he's working for the federal government. There's a man whose job is protected. He's probably in a union, and he can't lose his job. A lot of seniors, once they hit 55, and they're not even fully seniors, are going to have a heck of a time getting medical insurance if they lose their job. And I think that's something they should try to push back. Eligibility to buy into Medicare, even if it's at a full rate, once you hit 55, because those are the people who are going to have trouble getting coverage either from a pre-existing condition or because, they lost their job and they can't find another one that's going to give them coverage.
James Martin.
Yeah. Well, I agree, too. Again, as I said before, I don't believe in raising the eligibility age for those getting ready to go on Medicare.
All right. Simple. Our next call comes from Will in Oxnard, California. Will is 60 years old. Go ahead, Will.
Yeah, first of all, that gentleman that called in that was working for the federal government, he seemed to have a negative opinion of federal workers and talking about they don't need another desk. Well, he should give up his job if he's so opposed to working for the government. Let somebody else have it that wants it. And, the GOP, they believe in privatizing everything. But, you look back in history, the reason that Medicare and these social programs, they call them entitlements, these programs were started because people needed a safety net. They're not making a lot of money. But these guys from the GOP, they lost this last election. They got their hat served to them. And we need to let this president get out here and do what he's going to do, get some progressive politics in here, and stop trying to give corporations and private businesses all the opportunities. If you look at the disparity between wages over the past 3 decades between the rich and the middle class, it's deplorable. It's a shame. And the fact that when the Republicans ran government, they never did anything for a health care plan.
Will in Oxnard, California. Mr. Martin, go ahead.
Well, it's obvious where Will is coming from. But I would point out that Medicare and Social Security, great programs helping bring many seniors out of poverty. But the fact is, every time Republicans touched the third rail, if you will, it was Social Security scare tactics back in Barry Goldwater days when I was a young reporter. Now it's what I call Mediscare. And the fact is, to address specifically what the caller just mentioned, back when the Republicans took over the House in 1994, along about 1996, they came forth with a plan to try to fix Medicare, if you will. People know it's going to go broke. It's now 10, 12 years closer to being insolvent. The actuaries say it's 10 or 12 years away from insolvency. Even President Obama's chief of staff, Mr. Daley, said it may be only 5 years before it's insolvent. But the fact is, back in 1996, I believe it was, the Republicans came forth with a plan. They said this is an attempt to try to fix Medicare to keep it viable and alive for future generations. The Nancy Pelosi of that day, Richard Gephardt from Missouri, immediately said they're trying to dismantle Social Security, granny over the cliff. We're familiar with that, of course. The Washington Post, of all papers, and again, in this town, the Washington Post is known as a left-of-center paper. The Washington Times, a right-of-center, conservative paper. The Washington Post said that Mr. Gephardt's charges were, quote, bull feathers. That's their word. I'm quoting verbatim. They said the Republican plan is credible. The Democrats know it, and all they're doing is attacking Republicans. They must try to come together and fix this program. Now we are. That was 1996. Here we are 15 years closer to bankruptcy for Medicare. We're trying to fix it for future retirees, our children and our grandchildren.
Earlier in the segment, we talked about one of the callers brought up the estate tax, also known as the death tax. And in the Charlotte Observer this morning, when they addressed the topic of the fiscal cliff, they talked about the alternative minimum tax, writing that the tax was enacted in 1969 to make sure that the very wealthy paid some income tax, but the threshold for the usually higher tax was not indexed for inflation, and it threatens each year to ensnare millions of people it was never intended to catch, prompting the annual congressional fix. This year, however, the AMT is caught up in the broader fight over extending the President George W. Bush-era tax cuts and reducing government spending. The Internal Revenue Service warned lawmakers that if they do not act by December 31st, the number of people facing the AMT in April would jump to about 33 million from about 4 million who had to pay it this year. So my question to you, Mr. Martin, is if this situation is not rectified, what kind of an effect is the AMT going to have on senior citizens?
Well, of course, that alternative minimum tax was only impacting, I think, 150 or 160 people years and years ago. Now it's millions and millions. Again, a huge disparity. But the death tax, the estate tax, we call it the death tax. Again, there's a $5 million exemption now. It'll drop to $1 million, and the tax will jump to 55% come January the 1st. This tax on estates, some people call it estates if it's rich man's tax. The rich don't pay it. They set up trusts and foundations. You ever heard of the Buffett Foundation, the Gates Foundation? But small entrepreneurs, small businesses all over the country, farmers, if you will, and small businesses, they're impacted. I got to tell you, it cuts across philosophical lines too. I remember Oprah Winfrey opposed that tax, and I predicted that she would set up her own foundation. She did, and who can blame her for that? Whoopi Goldberg opposes that tax. When Jackie Kennedy died, Jackie Onassis died, they had to sell off a lot of assets to satisfy Uncle Sam. We don't think that the first claimant in line should be Uncle Sam, not even a blood relative.
Back to our discussion on older Americans and the economy, particularly looking at health care this morning with James Martin of 60 Plus Association. Our next call comes from Pam in Milford, Maine, on our line for Democrats. Go ahead, Pam. Thanks for waiting.
Hi. Yeah, of course, I'm 73 years old. I've been on Medicare since I was 65, and if I didn't have it, I probably would be dead by now. But the solution, I think, to Medicare problem is Medicare for all, because then you have the younger people in there too, and it reduces the overall cost. But I'd like to ask Mr. Martin about that cut to Medicare. My understanding was that some of those cuts to Medicare were to stop subsidizing Medicare Advantage. In other words, stop subsidizing the insurance companies who were providing Medicare Advantage. And, I certainly agree that raising the age for eligibility is not fair, especially for working people who work really hard and simply can't keep going. and probably have a lot more problems with their health than those folks who sit at desks.
Pam in Milford, Maine. Go ahead,
Well,
sir.
I agree, obviously, with not raising that at retirement age. But look, yes, the insurance lobby has been squeezed here, if you will. 2% profits. They say we should cut down even on that 2% profit margin that the insurance companies have. But I would point out that the AARP may be the largest insurance conglomerate left standing under Obamacare, the Affordable Care Act. Their profit margins are more in the 5% range. So there's a huge disparity there.
Our next call comes from Victoria in San Francisco on our line for folks over 55. She says that she's 79 years old. Go ahead, Victoria.
Yeah. Good morning, gentlemen. I'm 79 years old. I am a Democrat, and I wanted to correct some fellow that called before. I forgot which state he was calling from. But anyway, he said that, the money in the bank, we're not collecting anything. Well, I worked in a factory for over 45 years, and my mother always taught me, save a little money, and I always did, for a rainy day. And I used to get pretty good interest on my money in the bank. But now he said that under the Obama administration, we're not getting anything. Well, I want to correct him, because this has been going on for a long time during the Bush administration, not Obama administration. And like I said, I saved that money in order to, have a little nest egg, because I knew I wasn't going to get that much on Social Security. So I just wanted to correct that fellow. It didn't happen under the Obama administration. It happened during the...
Mr. Martin, go ahead.
Well, no comment there, except I couldn't agree more with the caller. It's happened in previous administrations.
Next up is Ryan on our line for Republicans, calling from Indianapolis, Indiana this morning. Go ahead, Ryan.
Yes, good morning. It's becoming clear to me that next month will be all about a question of whether to raise taxes on whom and by how much. Do you see a path to compromise on this issue? Are there taxes that we should put on the table? And then probably more importantly, are there proposals that should be taken off the table?
Mr. Martin.
Well, first and foremost, I would like to see the death tax abolished, if you will. We say kill it, don't wound it. All you're doing is making work for lawyers and accountants every time they tinker with it and they add pages to the tax code. That won't happen, of course. Unfortunately, the rate will go up to 55% January 1st unless something is done. I will make this promise to the callers. Yes, I'm way past retirement age. I'm 76. But I've made a pledge not to retire until we absolutely abolish the most confiscatory of all taxes, the death tax. And we'll do that by the year, my goal is by the year 2016. Why do I say that? Because it'll be 100 years old then. It was instituted 3 times before, tax on the wealthy to pay for war efforts. In 1916, unfortunately, it stayed on the books. It'll be 100 years old then. It's just like the tax on telephones back in 1898 to finance the Spanish-American War. Why a tax on telephones? Because only the wealthy had them. We only had 15,000 phones in the country. So it was a tax on the rich. Now we have 300 million phones or more. We helped get that tax called the federal excise tax lifted because it was a convenient piece of income for the government. We say the same about the estate tax, the death tax. We should get rid of it. It's not an income producer. Most of the money that comes in is wasted, if you will, on collection and on compliance, simply because the lawyers at the IRS argue figuratively with the lawyers of the rightful owners. So there's ample economic evidence that shows that tax should be abolished. Here's why. If you leave the money with the rightful owners, they'll either invest in existing businesses or invest in new startup businesses, meaning more workers in the workplace. I like to quote one liberal law professor from the University of Southern California. He and I both testified before the Ways and Means Committee some years ago. And he said at the outset, he said, I'm an unrequited liberal. And while I used to think that as a redistributionist that this tax was a tax that we should keep, he said there's economic studies now that show that if you leave it with the rightful heirs, it'll do what I just said. It'll produce more taxpayers in the long run, which means more revenues to the Treasury.
We've got a call from Bill in Toca, Georgia, on our line for Independence. Bill, you're on the Washington Journal.
Good morning, and thanks for taking my call.
Well, thanks for waiting, Bill. Go ahead.
The question I'm concerned about is when are we going to get some income or interest off of our money that we got on deposit? I don't want to point no fingers toward anyone. All I want to know is when are they going to get off of their ends and get some income into our people out here that's 65 and over that needs money to live on. Thank you.
Mr. Martin? Not really sure where Bill's coming from. All right, let's move on to Jerry in Dolton, Illinois on our line for Democrats. Go ahead, Jerry.
Hey, James, in all due respect, I'm not understanding how you align yourself with Republicans. Let's take some of the things that you had mentioned, for example, energy independence. Republicans have fought hard to not tax oil companies and fought hard to not support alternative sources. And that's empirically factual. Secondly, you talk about the $716 billion. Ryan, who was the potential vice president, if Romney had won, he would have cut it even more. He was very clear about that. Also, Romney is part, I think the older population is part of the 47% that Romney spoke so unfavorably about.
Jerry in Dolton, Illinois. James Martin.
Well, I'd like to comment on the tax on the oil companies. The fact of the matter is the oil producers provide 10 million jobs in this country, and I read an article just recently. They pay over $80 million a day in taxes into the federal treasury. So we say, let's get out of their way and let them develop more of our resources. I have a daughter that lives in Fairbanks, Alaska. My son-in-law is the 101st Airborne Stryker Brigade in Fairbanks. And she said to me, Dad, if it would ever get warm enough up here in Alaska, literally you could walk around barefoot and oil would seep up through your toes. We have an abundance of oil all over the United States. We need to develop our own resources, get out of the way of the oil industry and others. As I mentioned earlier, shale energy, which is the new, if you will, way to produce more energy, and break us away from the independence on foreign sources that may not always be friendly toward our country. And by the way, the $716 billion of cuts to Medicare, Mr. Ryan put forth a plan to try to salvage and save Medicare. It was not the end all and the wherewithal. The fact is he came forth with a plan. Unfortunately, the other side did not. We think that was at least a first step in the right direction to try to save Medicare for future retirees. Something has to be done because the old saw that ending Medicare as we know it. Ending Medicare as we know it, quite frankly, occurred with the passage of the Affordable Care Act 2 years ago because of the huge cuts to Medicare. And so many other things. The IPAB, the Independent Payment Advisory Board, 15 unelected bureaucrats who will make major decisions based on cost and cost alone. Seniors oppose that. And the other side always says, well, there will be congressional oversight. Baloney. The ruling says, the law says it'll take something like 2/3 of the Congress to agree. When are we ever going to see 2/3 of any Congress nowadays agreeing on anything?
We look forward to seeing that. The agreement, though. Mr. Jim Martin has been our guest. He is the president of the 60 Plus Association. If you want to get more information about their organization, you can go to their website, 60plus.org. Thank you very much for being on the program, sir.
Thank you. It's an honor to be with you.
Coming up, the co-founders of the group The Can Kicks Back will be here to discuss how the millennial generation views the looming debt crisis. And then later in the program, Georgetown University law professor Paul Rothstein will be here to talk to us about the secessionist movement in the United States. We want to let you know that yesterday, First Lady Michelle Obama, along with the daughters Sasha and Malia and their dog Bo, received the White House Christmas tree. The 19-foot-tall Fraser fir was delivered to the north portico of the White House. The tree is from the Peak Farms in Ashe County, North Carolina. Here's a little bit of what happened during the arrival.
The principle of secession being right